Hello, and welcome to this episode of Great Conversation. I'm very excited to be here today with our guests, Dr. Stephen Klepner and Dr. Justin Dhyani, who are both board certified and fellowship trained bariatric surgeons at Hackensack Meridian Ocean University Medical Center. Dr. Klepner and Dr. Dhyani have a special interest in weight loss surgery through robotic and minimally invasive approaches. So welcome to both of you.
Thanks for having us.
I'm so happy to have you here. So I have so many questions, of course, but first, why don't you just tell us a little bit about yourselves?
Sure. So I was born in New Jersey, born and bred, went to Rutgers, stayed in New Jersey for med school. Then I went to Philadelphia for training, up north in Valley Hospital for fellowship, and then I've been at Ocean Medical Center and Jersey Shore for the past 4 years.
Great. Awesome.
I'm actually from Maryland, so not from New Jersey,
That's
but
okay.
Did my residency training at Jersey Shore, loved it so much that after fellowship at Pennsylvania and Geisinger, I came back. So joined the group about a year ago and loving it, yeah.
Oh, that's fantastic. I'm so happy to have you both here. We chatted a little bit before we got started today, but I think I'll start off first with, we obviously have people throughout the country who have weight problems, and we talked about that a little ahead of time. So I guess bariatric surgery has changed over the years. So what does that look like now for people who might be interested in doing that? And what kind of person might fit the profile that would be able to get that?
So the basic qualifications for surgery, and a lot of it's kind of run by patients' insurances, but usually it's a BMI, which is body mass index. It's a calculation of your height and weight over 35 with a comorbidity. And that means that BMI over 35 with diabetes or sleep apnea or high blood pressure, or if your BMI is over 40, even without any comorbidity, usually you qualify for surgery.
Okay.
And the surgeries that we offer, the most common one's a sleeve gastrectomy, which we remove about 80% of your stomach. The next most common is the gastric bypass. Then we also offer something called a SADI, which stands for single anastomosis duodenal bypass, complete mouthful.
No wonder you only call it a
No one,
SADI.
we're not going to quiz you on that afterwards.
Yeah.
But essentially, that's a combination of the sleeve and kind of a long bypass. And that's for patients with a BMI really over 50 with really bad diabetes and things like that.
Sure. And how, if somebody were to get this surgery, what are they looking at as far as time frame for weight loss happening?
So the whole process to qualify for the surgery takes on average about 3 months. There's a lot that goes into qualifying and making sure that the patient's ready for it. We have a whole process that we go through where they meet with nutritionists and they meet with us serially to make sure that they're ready to make the change in their life. The weight loss starts right away, as does improvement in certain medical comorbidities like diabetes is cured almost overnight in most patients. Hypertension decreases over the course of a few months. And then over the first 6 months of your weight loss journey, the weight loss is pretty drastic.
Sure.
And then over the next year, it slowly peters off. And usually by 18 months is where you're going to be.
Great, great. So I have to ask the question, if you were to get this surgery, right, and then you lose the weight and everything, mostly because you're limited in how much you can actually eat. I guess that's how that works, or?
Yes, well, there's multiple mechanisms actually, yeah. So part of it is there's restrictive and malabsorption, but there's also a hormonal component that's not talked about a lot. So yes, in most of these surgeries, the stomach's smaller, so you're full more quickly, you're full for longer. In the bypass and the SADI, there's a malabsorptive component, so you're not absorbing as much calories and nutrients. But by doing these surgeries, your hunger hormones are changed a little bit, your insulin resistance, the way you digest sugars, because the way your insulin's processed is changed a little bit. And even your own GLP, which is very famous now for the GLP-1 drugs, is changed. So there is a strong hormonal component too that allows for weight loss.
Okay, because I was wondering, my stomach's smaller, but am I still hungry all the time? Is really the question. So you brought up GLP drugs, and I think that is another part of what you all do, right? So what does that look like, and how do you figure out what works best for people, I guess?
So GLP has kind of changed how we approach weight loss and really changed the whole surgery field. There are two main drugs, Wegovy and Zepbound, which are the two main drugs. There's a couple coming to the market in the future, but those are the two big ones. Surgery and drugs are not necessarily mutually exclusive. A lot of times we put patients preoperatively on the medications to help them start the weight loss process, and they have the surgery. And then sometimes at 18 months or even a little bit sooner, patients want to lose some more weight. So they could be on a GLP-1 after the surgery as well to get to the patients to their weight loss goals.
Okay.
On average, if you're on Wegovy, people can lose about 15% of their body weight. Tirzepatide is a little bit better, 15 to 19%. A sleeve gastrectomy, a little bit more, 20 to 25%. Gastric bypass, a little bit more, 30 to 35%. And then the SADI is a big weight loss, about 30 to 40% of your body weight. But we really reserve that for like patients, for very, very obese patients.
Right.
Yeah. The problem with the medications is it requires a lifelong commitment to the medication. Once you stop the medication, all that hunger noise that patients complain of comes back.
Right.
And it's a lot of self-control to prevent yourself from regaining the weight. And then there's also a subset of patients, about 10 to 30%, that don't even respond to the medications. If we get them onto the max dose, they lose less than 5% of their body weight. And and then we start talking about surgery even more.
Right. And those people, they're miserable while they're doing it, right? It's not even like it's fun.
Some people are very nauseous.
Yeah,
some people have no side effects at all.
Yeah.
It's very hit or miss who's going to get side effects, who's not going to get side effects. Most of the side effects are manageable. Only a small percentage of patients were taking off the medications because the nausea is so unbearable.
You mentioned, I want to go back for a second about the surgery, robotic surgery to do this.
Oh, yeah.
So we talked about, I guess that would be minimally invasive in order to get that done. So what does that look like?
Yeah, so both laparoscopy and robotics are both minimally invasive. The benefit of robotics, there's kind of two things. One's the camera's just better. So we can get closer to the tissue we're operating on. We can see better, so we can be a little bit more precise. And then the instruments we're using, the range of motion and the precision is actually better than our hands to some degree. So we can really operate more precisely, more accurately. And then with any minimally invasive approach, it's smaller incisions, less pain afterwards, faster recovery, all the things you think about for minimally invasive surgery. Most of our patients, like 90%, go home the next day after these surgeries. So you're up on your feet the day of surgery, and you're home the next day most of the time. Okay.
And then I guess what's the recovery once they're home? Is it just don't go for like a 2-mile run, or like what is the what does that recovery look like?
It's usually just no heavy lifting for a few weeks afterwards. You're walking, you're doing stairs. You can drive after a couple of days if you're not taking strong pain medication.
Sure.
You'll be sore for 1 to 2 weeks. It is surgery, but it's pretty well tolerated. Most patients don't even require narcotics afterwards.
Oh, that's great.
The biggest thing after surgery is the diet.
Yeah.
And we lay it out very clearly, very stepwise approach to advancing the diet over the course of a 4 to 6 week period.
And I appreciate that, because it's one thing to get the surgery, but then if you go back to eating McDonald's or whatever every day, that's not really going to help you, right? Because you're not getting the nutrition you need.
I tell a lot of our patients, the surgery is very helpful, but beforehand, it's about changing your relationship with food and changing how you handle stress and stuff like that. That really makes a difference and really allows patients to become successful. If they do the hard work before we do the surgery, then it becomes easy after the surgery.
And you said you have a nutritionist that you have people work with ahead of time?
Yep. At Ocean Medical Center, we have a team of nutritionists as well. So it's required that they meet the nutritionist before surgery and afterwards too. So they're doing the dietary counseling and all that stuff. Yeah, before and after.
Serious question. This isn't a joke. So if the person is getting, they have the surgery or they're doing the GLP-1s and they're meeting with a nutritionist, is it just the patient meeting with the nutritionist or the person who is cooking the meals also? That's a serious question.
That's a good thought.
I encourage, I love it when patients come in with their partners. It's great. Because you need a lot of support, 100%. The household needs to be on board, everyone needs to be on board, and a team really helps.
Right. Because if the person that's not doing the cooking, it's usually helpful to have that person involved.
Obesity also tends to run in families, so it is helpful if the whole family is involved in the weight loss journey.
All right, fantastic. I love that. So aside from weight loss, you also specialize in surgeries for other digestive issues. So what are some other digestive issues?
So we're both fully board certified, trained general surgeons. So we do a variety of just kind of normal general surgery. We take out a lot of gallbladders. We do a lot of groin hernias and belly hernias and stuff like that. But Dr. Dhyani and I are both trained in what's called foregut surgery. So that mainly hiatal hernia. So a lot of people who have chronic heartburn and reflux don't realize that that may be a sign of an underlying problem, something called a hiatal hernia, where the top of your stomach kind of pushes up through your diaphragm, and your body has a natural anti-reflux barrier, which involves the diaphragm and a part of the stomach. But once the stomach is up in your chest, it's gone. So a lot of patients have problems where after eating they're having really severe chest pain, or they can't lay flat because food comes up, and they really have to alter their diet. A lot of people are taking omeprazole or pantoprazole chronically, and they don't realize that it's a simple fix. Well, simple.
Yeah,
but it's fixable. It's fixable.
Yeah.
We can bring the stomach back down into a normal location, close the diaphragm, and then get patients off of these medications and improve their quality of life significantly. And we do it with the robot, which allows us to get really nice high up dissection, precise suturing, and patients do really well. And a lot of patients come to us and they say, wow, I should have gotten this surgery done earlier.
Right. It makes a huge difference for them, right? I have to ask off script here or off, whatever. What made you interested in going into this field? I mean, as a doctor, you have like the whole body to choose from. So what made you interested in doing stomach intestinal issues or whatever?
Well, surgery in general, you really see results right there on the table, which is great, which can be really satisfying. But for weight loss surgery, I mean, the results are just dramatic. I mean, rarely can you get patients, can you cure their diabetes, can you cure their hypertension, get them off those medications. So the results are just dramatic and really impressive. That's what got me interested in bariatric surgery specifically.
I mean, you get to see a positive end result.
I also really like that not every branch of surgery allows you to form a long-term relationship with your patients. We see our patients frequently and then yearly. So like if you do a gallbladder, you take the patient's gallbladder out. Thanks, doc. I feel great. See you later. Hope I don't see you again. I'll see you at Wegmans.
Right.
But when you do bariatric surgery, it's a journey that you're on with these patients, and you really form a close relationship with your patients, and it's very rewarding.
Yeah, even we see them at least once a year, even when their year is out. So
I love that. Yeah, it's so much nicer than like being on the conveyor belt of like, what's the next medication you're going to be on? Okay, good luck to you. Maybe we'll see you again. Maybe we won't. So I like that. That was fantastic. If there's someone considering weight loss surgery or any of the procedures you are all talking about, what would you say is their first step? What's the most important step?
Most important thing is to go talk to an expert like Dr. Klepner about it, because you might see a snippet about GLP-1s on Instagram or hear an anecdote on Facebook, and we live in this information overload society. You hear about things everywhere.
It's not also accurate all the time.
Right. So at best, you're getting a partial story or inaccurate information at worst. So you need to sit down with an expert for a long period of time, discuss your goals, discuss your medical history. And our goal is just to give you as much information as possible. We don't want to push a medication or a surgery. We just want to give you what the facts are. Right. Talk about what your goals are, and then we can get to a conclusion together.
I love that. Yeah, that's great. And so how can people get in touch with all of you? Where is your office located, and what hospitals do you work out of?
So we work out of Ocean Medical Center in Jersey Shore and Bayshore as of recently. We have several offices. One is right next door to Ocean Medical Center on Jack Martin Boulevard, 525. We have an Oakhurst office, which is currently under construction because of that major rainstorm that we had that caused the flooding.
They flooded out there.
Reconstruction.
And we have a brand new office beautiful office in Freehold, right on Route 9. I actually don't know the address off the top of my head, but
we'll put it up there.
Well,
Brick's where it's at.
Brick is where it's at. Yeah.
Oh, well, this has been really very great, and I mean, seriously great information. I've learned a lot. Is there anything I missed or anything you guys missed that you want to share that?
I don't think so. I think we covered everything.
I think just the most important thing for patients to realize is that our job isn't to operate on you. Our job is to help improve the quality of your life. And that's our main goal, is to just make you feel better about living, make you feel better about yourself.
That's fantastic. And through weight loss, you get to hopefully eliminate a lot of the other health concerns that you're having. It plays a huge role in high blood pressure and all the,
make you live longer, make you live
There's also a psychological improvement too. I mean, there's a lot of data showing that self-esteem improves, depression gets better, all these things get better after these surgeries too.
Movement.
Movement. That is another under-discussed kind of comorbidity, the osteoarthritis, the chronic back pain, chronic knee pain, all that stuff gets better.
Yeah, I love it. Thank you so much for sharing your expertise today. It was great having you. I learned a lot. lot. I hope you all learned a lot as well. Thanks for joining us on this episode of Crate Conversation, and we'll see you next time.